Okay, so the first thing I would do when entering a patient's room is check the door to see if there's any flags or markers that indicate any extra precautions for the patient, such as allergies. Next thing I would do is knock on the patient's door, make sure that they're decent and ready for me to come in. Then I would introduce myself to the patient, let them know that I was going to be their nurse for the day. Then wash my hands. Then I would ask the patient, what is your last name and date of birth?
O'Leary, 7/21/1999.
And then I would also check their wristband, just verifying who the patient is, making sure I'm with the right patient. I would then proceed to explain the procedure to the patient, what I'm going to be doing today. It's a head-to-toe assessment, and after we're done, I will go over your plan of care with you and just explain everything to you. So the first thing we're going to do with the head-to-toe assessment is a skin survey. So I'm just going to So I'm going to discuss the general appearance first, which his facial expression looks relaxed, he looks content. His body position is also relaxed. He doesn't look like he is in any apparent discomfort or pain. His mood seems pretty happy. He doesn't seem upset or angry. His speech quality and hearing seem to be pretty good. He was able to respond to me when I asked him what his name and date of birth is, so he was able to verbalize that and also hear me correctly. His personal hygiene is pretty good. He seems well groomed and he's dressed appropriately for the weather. His nutritional status seems appropriate as well. His height to weight ratio seems good. So the next thing I'm going to do is inspect his skin for color and uniformity. So his skin color seems to be appropriate for his ethnic background. It is pretty uniform throughout. There's no apparent lesions or any bumps or anything concerning. So the next thing I'm going to do is palpate the skin for temperature. It is warm to the touch. Next thing I'm going to do is palpate the skin for texture, just smooth. And then next thing I'm going to do is turgor. So I'm just going to pinch up on the arms, and it has a good elastic turgor. So at this point I would document any lesions I find, anything that might be of concern, report that to the provider. And I would also, if the patient had any dressings on his arms or anything, legs, I would check those dressings, make sure everything was good as well. I would also then proceed to use the Braden scale for skin risk assessment. If he was a patient that was at risk for a pressure ulcer, that's something I would use. And then I'm going to move on to checking his vital signs, which would be in a computer or on a chart. Someone might have taken them earlier. I'm just going to assess those vital signs and make sure that they're okay. I would address any issues that I needed to. Then I'm going to move on to a pain assessment. Can you tell me if you're in any pain today?
No.
So could you rate your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt?
0.
0? Okay, great. So now I'm going to move on to the neurological part. Can you tell me where you are?
Hospital.
And what is your name?
Dan O'Leary.
And the year?
2020.
Okay, great. So now can you just lift up your arms for me? And then put them back down. And just lift them up again. Can you just resist my hands? Great. Can you do the same thing with your legs? Lift them up, back down, then lift them up again. Just resist. Great. Okay. So now, your feet. Could you just push against my hands like you're pushing on a gas pedal? Perfect. Okay. So next thing I'm going to do is observe the patient's general face. The first thing I look at is the eyebrows and eyelashes. Make sure that the hair is evenly dispersed throughout. I'm also going to notice that the patient's face is mostly symmetrical from side to side. I'm going to look at the patient's eyelids, and they do cover half of the iris, so that is good. And then I'm going to look at the sclera of the patient, which is nice and white in there. And then the conjunctiva is nice and pink as well. So the periorbital area doesn't look like it has any edema, which is good, and the lacrimal apparatus doesn't seem to have any drainage, which is good. So next I'm going to use my pen light, just a regular pen because I don't have a pen light. I'm just going to look for in the eyes, direct and consensual light in each of them. Okay, great. And then can you just follow my pen light with your eyes? Perfect. So I noticed the smooth movement with the eyes. So now could you just sit up for a little bit? Thank you. So now moving on to the patient's ears. So just visually looking at the patient's ears, I don't see any visible lesions. Do you have any tenderness or any pain when I'm touching them?
No.
Perfect. Okay, so now I'm going to test your hearing. I'm just going to whisper 3 words into each of your ear. Can you just repeat them verbally out loud to me? 2, 4, 7.
Green, red, 7. 7, 5, 8.
So now I'm just going to notice the patient's overall facial appearance. The nose is midline, which is good. Everything else is symmetrical. So now I'm just going to have you do some facial expressions. Could you close your eyes really tight? Perfect. And then open them really wide. And then can you smile for me? And show your teeth. And then frown. And then purse your lips. Perfect. Okay. So now I'm going to assess your mouth. Your lips seem to be pink and there are no cracks or lesions. Now can you open your mouth for me? Use my pen light to look inside. The buccal mucosa seems pink and there are no lesions. Now can you stick out your tongue? So it looks as though your soft palate rises. The tongue is moist and it's rugged with papillae, and there's a thin coat, which is normal. So now can you lift up your tongue? I'm going to look under. It's pink with some vessels showing, which is also normal. Okay. Next, I'm going to have you stick your tongue out and move it side to side. Okay, so there's good tongue movement with that. Perfect. So now I'm going to move on to your neck. Can you just swing your legs around? So I'm going to notice the patient's trachea. Can you just look up a little bit, making sure that is centered down the middle. I'm going to palpate the tracheal cartilage rings, which seems to be normal. Now I'm just going to give you a sip of water. Can you just hold that in your mouth? Don't swallow it. So now I'm going to palpate both sides and to feel the thyroid. So now could you swallow for me? Using 3 fingers on one side and the thumb on the other to push over. Okay. Now can you take another sip? And do the other side. Can you swallow for me? Perfect. And now I'm going to check your lymph nodes. Take this. Okay. So first are the preauricular, which is in front of the ears, and the postauricular behind the ears, occipital in the back of the head, tonsillar is behind the jaw, submandibular is just right here under the jaw, submental is right here under the chin. Then we're going to posterior cervical chain, which are on the sides of the neck, and then superficial cervical chain, and then deep cervical chain, which is right here. Next, I'm going to move on to supraclavicular, which is just right here on the patient. So at that point, I would note if anything was palpable or abnormal with the lymph nodes. So now I'm going to have you turn your head side to side. Perfect. Okay, so now don't let me push this way. Perfect. Then same thing on the other side. Then can you just shrug your shoulders for me? Alright, now shrug your shoulders and then don't let me push down. Perfect. Okay, so now can you just take off your shirt? I'm going to have you, I'm going to do a chest exam now. So to start, we're just going to do a general inspection of the patient visually. And then his breathing seems even and unlabored. There's no signs of retractions or distress. His color is pink, and he's not using any accessory muscles up here in his neck to help with his breathing, which is good. So his AP diameter is 1 to transverse ratio is 2, which is normal. And then I'm going to now listen to his breathing with my stethoscope. I'm going to start on the back. Can you just turn this way for me? Okay. Okay, so make sure you're taking deep breaths with your mouth open. Deep breath in. again. And again. And again. 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 And one more time. So now I'm going to listen to the front. If you just turn and face me. Can you breathe in? Again. 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 And one more time. Perfect. So next I'm going to have you take some deep breaths and you try to cough for me. So you have any secretions?
No.
Okay, great. So at that point I would just instruct the patient to use an incentive spirometer, which can help with their breathing. So next I'm going to move on to cardiovascular assessment. You just lay flat on your back, please. Okay. So I'm looking at the neck for some jugular venous distension, which the patient doesn't seem to have here. So next I'm going to check the heart rate. So I'm just looking right at the apex for regularity and rate. So the heart zones seem to be clear. Now I'm just going to check with the radial pulse. So there seems to be no pulse deficit. So the next thing I'm going to do is listen to the 5 places of the heart. So the first is aortic, which is sternal border second intercostal space. And then the next is pulmonic, which is left of the sternal border second intercostal space. And then Erb's point, which is third intercostal space left of the sternal border. And then we move on to the tricuspid, which is fourth intercostal space left of the sternal border. And then mitral, which is also the apical pulse, which is midclavicular line, and fifth intercostal space. So also going to listen with the diaphragm and the stump as well. At that point, if I heard anything that sounded like a murmur, I would then sit him up and turn him to his left lateral side so that his heart would be close to the chest walls. So next thing I'm going to do is check the capillary refill of his fingers and his toes. So starting with the fingers, then moving on to the toes. So I just have to make sure that that is less than 3 seconds, which it is. So next we're just going to be observing the patient's legs, especially in the calves, looking for any swelling, edema, anything like that, and any unusual colors. So next thing I'm going to do is check the pulses. Start with the the brachial pulse, which is up here. And then I'm going to move on to dorsalis pedis, just in the foot. And then posterior tibial in the ankle, and we're going to do that on both sides as well for all of them. Okay. And are you having any pain in your calves today? No?
No.
Okay. So at this point, I would also observe and look at any IV sites he has for infiltration or infection as well. So, and also, if you are checking the pulses and you can't get a read on them, you can't really feel them that well, you can go and get a Doppler machine. That's going to help you hear softer pulses. You double check yourself if you can't find a pulse, you're not sure. The Doppler machine is going to help you. So the next assessment I'm moving on to is the abdomen. Just move your hands through. So I'm just going to look at the overall contour of the patient. He has a flat abdomen. So the first thing I'm going to do is also auscultate. And listen to all 4 quadrants of the abdomen, and I'm listening for bowel sounds. Just turn it off for a second. So he has normal and soft bowel sounds. Do you have any pain today in your stomach? Okay. So I'm just going to palpate the stomach lightly. Okay. So he had soft, normal bowel sounds. And when is the last time you had a bowel movement?
Last night.
And what was the color?
Brown.
And consistency?
Soft.
And are you doing okay with urination? Are you having any difficulties?
No.
Okay. And any pain with that?
No.
Okay. And do you happen to know the color of your urine?
Yellow.
Okay. So at this point, if the patient had an NG tube or a Foley catheter, I would note any drainage. I would inspect that for color consistency as well. And at this point, I would also possibly do a bladder scan. That looks at the volume of fluid in the bladder. The reasons that you might do that for is if the bladder's distended, if the patient hasn't urinated an extended amount of time, things like that. So you can put your shirt on now, and we're going to move on to a mobility assessment. So the first thing I'm going to always do is make sure that the bed is in the lowest position, the brakes are on, obviously have the side rail down. So also I'm going to look at the chart for fall risk assessment for this patient specifically. Note any risks, any potential risks I would have having this patient be mobile and walk. So do you use any assistive devices?
No.
Okay. Are you dizzy or lightheaded today?
No.
Okay, great. And do you have any problems walking?
No.
Okay. Okay, so at this point I would also remove any SCD equipment that the patient has on his legs for... Okay. So can you just stand up for me? Does that feel okay?
Yep.
So I'm just going to have you walk over here. Can you just sit in this chair for me? Great. Okay, can you stand up this way? And just walk 10 feet this way for me? And just turn around and walk back. So I'm noticing that the patient's gait is slow and steady, which is good. So now I'm just going to have the patient lay back down. Let me just put that up. I'm going to put the side rails back up for the patient. I'm going to also make sure that the patient has a call signal in his hand. We'll also use this. Make sure, call signal. Make sure they're comfortable, everything's all set with them. Then I'm going to go through the patient's plan of care, just to make sure that they're able to understand everything that we went through today. I'll let them know about my findings, and then we'll just go through together and make sure that the patient understands what we're going to be doing. So after that, I make sure the patient's all set. He's comfortable. I'm going to perform hand hygiene. Then I'm going to leave the patient's room. I'm going to document the assessment, all my findings, everything that I might need to report to the provider, and I would then check to see if there's anything that I missed on this assessment.